I'm going to pass on the mic over to Roberta.
OK， 嗰條問題咧就係問如果兩間醫院合併之後咧，有冇啲咩危機啊？咁就Dr. Ray 就話咧，其實好啦，佢哋俾咗個譬喻咧，就係喺墨西西加市嗰度咧，喺舊年嘅時候咧都有兩間醫院係合併嘅，咁就係Credit Valley 啦同埋 Trillium 嘅。咁兩間醫院合併咗之後咧，就可以服侍100萬嘅人。咁咧佢就覺得咧就好大，就非常之好。咁再加上咧喺downtown大家都知喺下邊咧，佢哋都有好多大醫院㗎。咁如果喺個士嘉堡區咧，佢就話我哋冇一間咁大間嘅醫院，咁所以咧佢有考慮過就會合併。咁另外第二樣咧，佢就話因為而家經濟都衰退啦，咁大家都知道而家物價指數都高啦。咁佢話咧，如果嚟緊嘅1年裏邊咧，政府未必肯俾1個百分點嘅加錢加款嘅款項加1%，佢話都可能冇。咁如果係咁嘅話呢，咁就喺嚟緊嘅幾年之後呢，佢哋就會有一個負面嘅帳簿啦。咁所以呢，佢就話再加上呢，佢想增加幾個服務啦，譬如話喺先排呢有講過，我哋呢度士嘉堡區呢係冇一個真係專係照顧有癌症嘅病人嘅。咁佢希望咧喺士嘉堡咧都有間咁嘅地方，可以專係照顧呢啲有癌症嘅病人，同埋有洗腎嘅需要嘅人嚇。咁係咗咁樣之後咧，所以咧如果係做啲咁加多咗呢啲服務咧，佢嘅支出就會更加大啦。咁嚟緊呢一年咧，佢或者會可以平衡到佢嘅支出，但係喺出年或者第2年、第3年之後咧，佢可能攞唔到嗰個平衡嘅時候咧，咁就會有個負，咁就唔知點算啦。咁因為咁嘅原因咧，佢就諗緊喺東方醫院多倫多東方醫院咧嗰度嘅佢哋如果兩間醫院合併嘅話咧，大家一齊去合力咁去籌款咧，就可以籌到多啲錢咧，就可以對呢個抵消呢個經濟。咁後嚟咧，Ed 就問多一個問題嘅，咁講咗經濟，講咗呢啲啦，咁其實對老人家嘅或者對病人嘅照顧服務有冇分別，有冇影響到咧？咁Dr. Ray 就話咧，因為兩間醫院咧都好重視嗰個品質嘅，咁所以咧如果係佢話係特別係士嘉堡醫院咧，喺幾年前嗰個大家都睇報紙咧，就佢哋嘅死亡率係最高嘅全安省咁多間醫院。咁佢就話咧，而家就好咗啦，喺上個月咧，大家唔知有冇睇到報紙啦。咁佢哋係變成係最好嘅。咁佢話如果係因為咁嘅話咧，佢就覺得服務嘅質素咧就好重要啦。咁佢覺得如果兩間醫院大家都有同一個目標咧，就會可以有對幫助兩間醫院嘅服務都會有幫助。
Thank you once again. Next question is about the staff of Scarborough Hospital. We're going to get to questions shortly, sir. We have a chance to ask Dr. Wright some questions, and we'll shortly get to the audience. The question around staff is, okay, well, thank you. She's going to record your message, your question, and we'll get it answered very shortly. Do the doctors feel that the merger, or in this case think rather, that the merger is a good idea?
In a short word, no. But the reason is, and I sympathize and understand it very clearly, doctors work with one patient at a time. They are interested in you on the time you are in their office. They're like at the rock face, working very, very hard. They are not trained in the overall system or how the healthcare system works, nor do you really need them to be to get that kind of quality of care. So that their issues are today or tomorrow or the next operation or while they're right there on the operating table. So there's very little in a merger that would offer something to them because they're not going to get anything more, and it's a bit, and it can be disruptive. But my job as a CEO is to look out 5 years and to look out 10 years. My job is to be sure that there is still a Scarborough Hospital in 10 years' time, and that in spite of the pressures of the budgets, of good times and bad times, that not only there's a Scarborough Hospital, but it's bigger and better and doing different things than it does now. So that it is extremely important to look ahead and be sure that we create the kind of hospital for you going forward. No program is going to shut because of this merger. Now, one of the interesting things is if you were to ask a number of people, they would say that the merger between the Toronto General, the Scarborough General site and the Old Grace, the Birchmount, was unsuccessful. That's not correct. It is successful because the Birchmount campus is still there, is still a full-service hospital, still has a full-service emergency department, and is still there for you when you need it. If they had never merged, if they tried to stay it alone, there is no 200-bed hospital standalone in an urban center in the province of Ontario. They're too small, the fixed cost is too big, and they end up like St. Joe's in London doing not chronic care, but convalescent care or rehab or they are not full service. So you may hear that, but in fact the Birchmount is a success story in those terms. Could we have done more? Yes. Could the docs have taken better advantage? Yes. Was it well managed? No. But one of the things we're trying to do now, if this goes ahead, is to be sure that we don't make the same mistakes then that we did back then, and that this is a much smoother and more effective process than 15 years ago.
Thank you. This is a good segue. I just realized that Dr. Robert Ting's here with us this evening. Robert Ting, recognize you as well. As you just listened to Dr. Wright about the docs not in support of this, what are your thoughts on the why, perhaps? And some of, perhaps maybe a chance to talk about Dr. Wright's comments.
Want to come up? I'm Rob Ting. I'm president of MSA, and Elijah's the VP. I work out of the general site. Elijah works out of Birchmount. The doctors are actually quite opposed to the merger. You have to see where we came from. We've been through a merger before. We've been through the merger between the general and the Birchmount. It was very, very disruptive. And, you know, a lot of the motivation behind this current merger is to save money. And with the past merger, we never really saw huge savings in money, okay? And the two hospitals really have worked in separate silos. We haven't really done a good job of integrating programs or consolidating things, so we're a little bit skeptical. We've also been through a very, very difficult time at Scarborough General in the Birchmount because, as you may well know, we had a supervisor come in. We went through many, many CEOs. And the morale at the hospital for the physicians has been quite bad for some time. Only really in the last 2 years, 2-3 years I think, the morale's actually started to pick up. So when John started talking about the merger, we thought, oh my God, here we go again. Back to like, because it really took us almost a decade to get over the last unhappy merger, and then we were worried, here we're going again together, okay? As negative as we are on the merger, it turns out that the doctors at the Toronto East General are even more opposed than we are. Okay, we polled our medical staff. 89% of our doctors were opposed, but at Toronto East General was 96% were opposed. So it was even more opposition there. They had their issues as well at Toronto East General because they also too had a supervisor. They had like problems. Sorry. That they like their hospital the way it is. I talked to their MSA. They're in that pocket. They really feel that, you know, part of the problem also with us is the distance. Okay, and it's not just the distance. There's no easy access. It's like, you know, I can tell you when we work in two sites right now, traveling from the General to the Birchmount back and forth is not easy. But our hospitals are relatively close compared to where the Toronto East General is. all right? And a lot of our flow of patients has been along the 401. So like, for example, if you have a heart attack at Scarborough General Hospital and you need an angioplasty to open up your heart, okay, it's much quicker to send you to Rouge Valley Centenary than it is to Toronto East General, okay? And to spend like 20 minutes in an ambulance when you can spend 5 minutes, we're not going to do that. We're going to, the more natural flow is across the 401. I believe John has talked to the CEO at the Centenary Hospital, the Rouge Valley. We've also talked to the medical staff, the president of the Medical Staff Association. We talked to their chief of staff. Their vision that they told us was that they would like to build one new hospital in the center of Scarborough. Okay, like all 3 hospitals. Apparently their ORs need renovation. They're talking about 150, 200 million. They're saying our hospital, we need new ORs, about 240 million. So they're saying, why? Okay, you already got like a $400 million price tag there. Why not merge together, save $100 million a year on operating budget, and use that money to build a hospital in the center of Scarborough. When they talked to me, they told me that the hospital would be ideally located at McCowan and 401 right in the center. When I talked to John, he says that they would be interested perhaps in building a hospital over by, because they have 25 acres of land that they may want to build over there. So, did you want to?
No, it was Nielsen.
Yeah, Nielsen Road. So, I think right now, you know, I think when we met with the Corpus Sanchez people, the one thing they did say, the one thing they did say was that in all the years they've been doing mergers with hospitals, they've never met a group of doctors that were so hostile and so opposed to a merger. Okay, like, so that is a very, very big hurdle for the senior management team to overcome. Because I think for any sort of merger to be successful, the people that work in the hospital have to be, if not opposed, at least neutral, or have an open mind, all right? And one of the things that the CEO at the Toronto East General said is to his medical staff was, if you guys aren't on board, then I haven't done a good enough job telling you why we need to do the merger, right? And I met with John at our board retreat, and I said, well, you haven't, you know, you need to tell people why you need to do the merger. Because right now, as the medical staff, I can tell you, don't feel the sense of urgency that the senior management team feels. And a lot of people feel like we should do a better job. If we're going to consolidate services, we need to do a better job between the Birchmount and the General first, get this one merger done, like sort of like make peace with your wife before you get a mistress. You know, I don't know. Like, it's just like, you know, like, I don't know. It's, and the pastor that baptized me is in this room, so that's really bad. Do you know my? Do you want to say anything?
Let's tweet that one.
Thank you, Dr. Ting. So, although we are 2 different hospital sites, and it has been very difficult for the General site and the Birchmount site to get together, I have only been at the Birchmount site for about 2 years now, and I have seen a big change, especially with more people moving back and forth. And I think this is one issue that has actually brought all the doctors at both sites together in saying, let's fix what we have now before we take on more issues. And that's where we are at.
Thank you. Dr. Ting, I don't know if, did you want to do some translation on to the, okay? Amanda, okay, sorry. We'll go back to the Cantonese translation. Okay, well.
Make it short, OK？就頭先問到究竟啲醫生喺間醫院裏邊，佢哋同唔同意啦？咁頭先Dr. Ting已經講咗啦，佢哋嘅醫院嘅醫生咧係好唔同意，係非常之反對呢個合併嘅。咁另外多倫多東方醫院咧，佢哋啲醫生都係同一樣嘢話係唔喜歡呢個合作。咁佢哋就話，如果係咁嘅話咧，佢哋如果係真係要勉強嘅話咧，就會有好多難處啦。咁再加上咧就話其實咧每2間醫院下多倫多 東方醫院同埋士嘉堡醫院咧都有佢哋自己內部都有好多問題，咁都要解決嘅。咁佢哋希望咧係暫時嚟講係應該係集中係點樣去解決呢個問題，好過話諗下點樣去合併。咁如果真係要合併嘅話咧，其實佢哋提過咧就不如士嘉堡3間醫院，應該係2間，因為係士嘉堡醫院啦，加埋頭先我哋講嘅兆康醫院咧，佢哋可以試下3間醫院合埋一齊咧，就因為士嘉堡醫院即係真係2間，係咪因為有慈恩嗰個 site 同埋有恩澤啊，而家個恩澤係唔好意思，係恩澤同埋另外嗰個係多倫多唔係士嘉堡聯嗰個 site central site 叫做乜嘢？OK， 唔緊要啦。總之總之就係3間醫院合併咧，就比較好過咧，就係淨係講係同東方醫院啦。
Thank you. One last question, and then we'll open it up to the audience. This one's related to the merger, and specifically, we know through literature reviews and data that mergers carry, the more successful mergers in this case, carry from a position of strength, right? We talked about the fact that, you know, the whole marriage situation, we kind of fix home first before moving forward. We're concerned that there are significant operational weaknesses inside the Scarborough Hospital. To list a few facts, patient satisfaction rate is 55% compared to the provincial average of 85%. Emergency room wait times is about 2 days, twice as long as the provincial average. Given these alarming performance metrics, don't you think a merger is rather a distraction from the more serious issues at the hospital that actually are impacting healthcare delivery to our residents?
Thank you. I won't criticize your numbers, but they're not exactly correct. But some numbers you should know are that in the since I have arrived, staff satisfaction went up in the first 2 years 12.5% and then 9%. And physician satisfaction, doctors are always modest, went up in the first 2 years 14.7%, and in the last 2 years another 9%. So they are now up and well above the provincial average. However, what you say is very true. In what you're saying is, shouldn't you keep your eye on the ball? Is this going to distract you from the other things that you have to do? And that's a very valid point. It is something that what you do in industry is you take the group that is working on the merger and putting things together, and you separate them as much as possible from the people making the daily decisions and leading the strategic direction of the hospital in that area, so that you try and separate your operational issues from those. So that actually is a very good point. Just one point about building a new hospital out on the Centenary site on Nielsen and closing the hospital Scarborough General. That would be a $1 billion enterprise, and I've tried to explain that the province is not in any financial situation to invest $1 billion anytime in the next 5, 6, 7, 8 years. And it would also take 15 years, and because that's how long it took Humber just to put a shovel in the ground, and that in that 15 years, no one would be getting any operating rooms. The emergency department at the Birchmount would not be expanded because you don't invest any money if you're planning on tearing it down. And finally, just there is nothing that means we couldn't go ahead with that. In fact, I believe that if we had all of the hospitals in Scarborough under one management umbrella, that would be including centenary along, we would have a very strong voice, and there'd be nothing to prevent us from moving ahead and recommending this kind of future for Scarborough. So I just want to put that a little bit in perspective, that's all.
Thank you. And Roberta?
咁就頭先阿 Edmund 咧就話其實士嘉堡醫院咧而家都有啲好多問題嘅，譬如話佢哋嘅病人嘅滿意指數咧得55%，咁而家成個省嘅其實省嘅指標咧就應該係85%嚇，佢哋得55%。咁如果係急症室嘅等候咧，佢哋要2日，咁咧就係比同其他安省嘅醫院係2倍以上嘅，咁所以咧就覺得佢哋點解目前有呢啲咁多問題唔做，就要講係合併呢件事咧。咁就頭先Dr. Ray 就話咧，其實呢個問題佢就覺得過去喺佢做過去嗰5年裏邊咧，喺士嘉堡醫院做咧病人嘅滿意指數同埋醫生嘅滿意指數咧都係有提高，咁然之後咧咁事實上咧，其他嘅咧都係有啲商榷餘地，即係話佢哋係有啲嘢應該要考慮嘅。不過佢重新再提翻咧，就話如果喺士嘉堡裏邊所有嘅醫院能夠合併成為一間咧，係非常之好嘅事。咁但係如果要喺 Nelson Road 同埋401嗰度起一間醫院，而將佢哋嘅總醫院暫時要停嘅話咧，咁個恩澤嗰邊嗰間醫院嗰邊嗰個地址嗰邊咧，就係未必可能可以照顧到咁多病人，咁咧可能有好多病人咧，因為咁嘅原因咧就唔夠服務啦。
Thank you. Okay, so this is a time for you to be involved. So I'm going to open the floor for questions, and what I'm going to do is going to run over and hold the mic, and then please remember to introduce yourself and obviously your question, sir.
Oh, no. Well, my name is Alpha Chen. I live in Scarborough for over 25 years, so I know Scarborough very well as too. But now these mergers, the CEO told us that the Scarborough Hospital are in the position of shortage of funds because, first of all, it is the funds go with the patients. That's why so many of the funds go to Ottawa. But then, why the patients are in Scarborough? Why the funds go to Ottawa? Secondly, is about the provincial cutting. Well, this cutting is applied to all hospitals, not especially to Scarborough Hospital. So I don't see why that these are the two major reasons for the shortage of funds for running the hospital, Scarborough Hospital. I actually want to emphasize the only advantage of this a combination of Scarborough, Toronto Eastern with our Scarborough is that because Toronto Eastern is a university training hospital, so that's why there will be more advantage. This is the only main advantage for this merger.
Thank you very much. Dr. Wright, you want to answer that question?
I couldn't agree with you more. I mean, the funds should follow the patient, but they don't. They don't. They have global budgets, and it would be that issue around funds going in one direction when the actual patient is going in another is a real issue, not just for us in Scarborough, but in many areas. I agree, that's the way it was. Now, I didn't hear the last part of your question about East General.
Because of the deficit,
yeah.
So they are cutting the funds, the health funds to the hospital. That's what you are saying.
Yes, yeah. Well, they're not going to cut, because Sue Wong will jump all over me if I say that. They are increasing slightly, but not nearly as much as the costs are increasing.
So my name is Viresh Mathur. I'm a long-time resident of Scarborough, actually lifetime resident of Scarborough. I've been through all the schooling here and grew up here. I have two questions. One, the CAC, your Community Action Committee, they've been consulting professionals, but they haven't been consulting any of the public. There has been no public forums to ask about what the effects of the merger would be on the public. You've been going around to the different professionals, the doctors, and all the medical stakeholders, but the public is a big part of it. And that's part of the second question of mine. Last week, my father had a mini stroke, a TIA, and when the paramedics came, they were debating which hospital to take him to. So they wasted, I'd say, about 2 or 3 minutes debating whether they should go to Centenary, whether they should go to Scarborough. So by having these mergers in the past, some of these facilities were taken away. So there was some issues about where to take my father. So can you answer those 2 questions?
I don't quite understand why they would be concerned. It may be possible that they were worried about how busy one of the emergencies was, but I don't know. But the question about the Community Advisory Committee, it is the public. It is the community, and it's our major link with the community, and the meetings are open, and you're welcome to attend them. The time to go to speak to the community is right now. We haven't made the decision. We have some information. We are able to speak to some of the issues. So basically, we're here and now and listening to your questions and making notes and taking that forward.
Of the hospital. Now, there are various media outlets where they have information about what's going on in the community. The ANCs, they posted on there, they have information about what's going on in the communities. In Scarborough Rouge and Scarborough Aging Court, the ANCs, the Action for Neighborhood Change, they had nothing on their bulletin boards about hospital mergers, and other community blogs and where most of the local people can access information about the CAC is not there. So the question is, mergers are, we have to look at the cost factors and providing these services for the residents. But if the residents don't know about what's going on, and then all of a sudden they hear about this, there would be some sort of negative backlash.
The classic consultation process begins, because we haven't even notified the LHIN. When we speak to the LHIN, then we begin a 60-day consultation process before any kind of decision is made. So my point is that it's just a bit early, but I think Karen from our Community Advisory Committee wants to respond.
I don't need the mic, I'm fine.
No, I think you will, actually.
One of the things, is it on? Oh. One of the things, we've discussed the issue 3 or 4 times in our meetings, and in our last meeting, we talked about, once the consultants' reports were in, having a town hall meeting and having a widely publicized town hall meeting and getting community feedback. It's something that we discussed. We know it's a critical issue. It's also important, I think, that I make it crystal clear on behalf of the CAC. We have no formed opinion on it, despite any rumors to the contrary. We have yet to form an opinion. We were waiting to get all the information and then to have a large public meeting, which we would publicize. It had been our expectation that would be in around April or the beginning of April.
I can't see any proper benefit by merging East York and Scarborough General Hospital. Because number one, they are very far from each other. Let's say if my irregular heartbeat started again, where are you going to take me? To Grace Hospital or to East York Hospital? And I am going to have a heart attack on 401, which is impossible. And second, we are speaking about overdoing, there is a long waiting list for emergency and so on. That means East General doesn't have any patient When we go there, they will be overloaded, and then we will wait there for 2-3 hours. What is the difference? I don't see any benefit from this.
That's a good question. There will be no change. You'll go the same place as you go now. And in fact, we were not moving the service from East General to Scarborough. They're too far apart, although 22% of the patients at East General are Scarbarians. They are from Scarborough. No, but that is Scarborough, south of, yeah, right? That's not where your district is, I guess. So that there will be no change. And right now, we have for instance, a very good relationship with the cardiologists at Centenary. And if you need angiograms, you'll go there. You will still go there. I went there, and if you're cooked again, you'll still go there, whether there's a merger or not.
When I was on emergency and went to Grace Hospital, they took me right away without registration. They saw my situation, they took me right away in. So I didn't wait. They know who needs emergency. So why I have to go to East York?
You don't.
So then we don't need this, we don't